Yeah, you can share your screen now, sir. Should I do it for you?
Yeah. Is it visible?
Yeah, visible. Yeah. Could
Right.
you please
Thank you.
do it as yeah. Okay, it's
Yeah.
done. Thank you.
Holistic ECP for full body care. Here I've intentionally written W before the holistic. Normally we write holistic with H, because I want everyone to understand that holistic is both with W and without W. When I write W, I mean the whole part of the body. That is why I want to write holistic. My greeting, my thanks, my appreciation, my gratitude to all the organizations, Dr. Millie, Renuka, and everyone else for the wonderful conference. And when we talk of holistic, uh, let us remember all the colors of the rainbow, where holistic contains everything. Everything is included in holistic. And when I talk about external counterpulsation, the person whom I really remember is a former president of India, Dr. Abdul Kalam, because years back, he had said in some of his lectures that ECP has application for many diseases relevant to India, particularly cardiac diseases. When I say many diseases, it is very important that it is not restricted to the cardiac disease alone, which most people think. Now, what is external counterpulsation? External from outside the body. I'm going to rush through because these are basic things. No catheter, no surgery, no laser. Counter raises the diastolic and lowers the systolic blood pressure. And this is in a pulsatile fashion. It is done in a very simple way. Patient wears exercise tights. He lies on the bed. Electrodes are applied on the chest. A sensor is applied on the finger to see the counter pulse. Cuffs are wrapped around the legs and arms. When I say and arms, I'm very particular because most machines do not have the arm cuffs. When we add the arm cuffs, we have seen that the counter pulse is created at a much lower pressure. So it is more comfortable to the patient and the effectiveness is more. Some say it is 15%. I do not know exactly how much. The mechanism, when we repeatedly do this, the dormant blood vessels, they dilate. So the capillaries which are there since birth, but which had not opened up, the reserve that God had given us, that starts working. There's stimulus for formation of new blood vessels. And there's dilatation of the blood vessels. These are the main, other than this, there are many other mechanisms also, but these are the main ones. And as you can see, the blood flow to the heart increases by 20 to 42%, brain 22 to 26, kidney 19%. And when blood flow is increased, I can say that the first thing which is required for any treatment, we may give any drug, we may give hyperbaric oxygen, we may give any nutrients, unless they reach the site, they are not going to work. So the main thing is that the circulation, the better the circulation, the more effective will any treatment be. There's a lot of people keep on asking about the approvals. It is mentioned in the leading textbooks. It is approved by all these FDA, CE, etc., etc. It is mentioned in a number of journals. If anyone wants, he can just email me or WhatsApp me and I can send you a copy of all this. So you need not note anything and just pay attention. It is available worldwide. Worldwide means in the leading centers of the world. And if we talk not only leading centers, the leading citizens of the world have also had ECP. For example, Bill Clinton, after his bypass surgery and after his stents, he had ECP. Our former Prime Minister of India, Dr. Manmohan Singh, he had ECP. Our former President of India, Pranab Mukherjee, he had ECP. And this ECP to these people was in addition or after the stent and bypass. So you can understand how effective it is, how useful it is, and how much it can help us. The typical story: age 40, 50, 60, or 80 years. Family history may be positive. diabetic, hypertensive, many of them smokers, lack of sleep, especially the modern IT sector people, chest pain, breathlessness, weakness, diagnosed to have angina or MI. But some patients are not fit for angiography. Some are fit for angiography, but they are not fit for stent or bypass. That is 5 to 15% of cardiac patients. Those with microcirculation who may be fit for stent or bypass, these procedures are not as effective in them as in the rest of the population. High-risk patients in which any intervention may increase the morbidity and mortality, or patients who have already had stent bypass, and no further treatment is possible. There are then patients who the patient or the relatives refuse because the patient they feel is too old, is too weak, or for cultural reasons. They don't want any cuts on their body. They want to go back to heaven in the same way as God sent, without any cuts on their body. Or a big curse in India, the biggest disease in India is poverty, and many patients cannot afford it, and they do not have even the insurance. For all these patients, heart disease is a death sentence. When the doctor says you are unfit or for any reason the stent or bypass is not possible, what the patient hears is, the game is over, it's time to leave the earth. But the patient, his attitude is, I want to live. What's common in all of them? A death sentence has been given, the game is over, he is told, and the patient wants to live. Won't a treatment for all these patients be a lifesaver? Of course, yes. I'm building up why I'm saying that it is holistic. I'm just coming to the basic part first. The dilemma, we see so many patients, 90 to 100% blockages, but no angina, and normal coronaries having angina. Is the angiography reliable? Is our diagnosis right? If diagnosis is not right, how can treatment be right? Where have we gone wrong? Definitely, the angiography is not telling a lies. Maybe it is not telling the full truth. Myth 1, coronary artery disease is a disease of the heart. Fact, coronary artery disease is not a disease of the heart. It is a disease of blood vessels that has starved the heart of blood, oxygen, nutrients, hormones, and does not allow the waste to be shifted out, and the waste accumulates. Myth number 2, blocked coronaries cause ischemia or angina. Fact, not blocked arteries, but decreased blood flow causes the coronary artery disease. Example, angina with normal coronaries or angiography. So flow is important and not blockage. Blocked arteries compensated by collaterals need no treatment. Nature, God has already treated that patient. This is where patients and many of our colleagues are overlooking that flow is important, not the blockage. And this is because blockage in large arteries decrease blood flow. Collaterals compensate for this decrease. Angiography shows blockages in large arteries, but cannot visualize the smaller collaterals. Hence, large vessels seen blocked on angiography are advised angioplasty, stent, and bypass, even when compensated and there is no decrease in blood flow. So where have we gone wrong? Cardiac treatments are based on angiography, that is blockages, and not on the flow. Solution, let us measure the blood flow and not the blockage. Our thinking changes dramatically. Treating blockages, when we talk of treating blockages, what comes to our mind is angiography, angioplasty, stent, bypass. And when we think of treating flow, what comes to our mind is lifestyle management, medicines, EMR, spinal cord stimulation, stem cells, ECP, ESMR, chelation therapy. So this is where the whole thing lies. If we think of blockages, we think of stent and bypass. If we think of flow, we think of ECP, ESMR, and chelation. Now, the indications, cardiac indications for ECP are angina, myocardial infarction, especially in microvascular angina and congestive cardiac failure. We think of blockages and not of flow because we have been blinded by what we have been taught. Maybe ignorance is a bliss for many because it is ignorance which makes us think laterally, whereas education blocks our lateral thinking. It is like the horse who has blinkers put in, and due to the blinkers, he does not see right or left. Whereas the world is not just in front of you, it is a whole world in front of you, left, right, above, below, and the back. So for thousands of years, we have been blinded, and we need to get out of that blindness. And those people who do not understand functional medicine, who do not understand holistic medicine, who do not understand the various other modalities of treatment, it is this blindness which has been caused due to education in one particular direction. And when I say one particular direction, I do not mean allopathy. Whatever the direction a person has been taught, he gets blinded to all the other systems. Whereas we need to remove our blinkers and start thinking laterally. These are some examples of how man was blinded for ages. For thousands of years, it was thought that man cannot fly, till someone, the Wright brothers, they differed and they thought out of the box. And today, a person who says you cannot fly will be taken as a foolish person. When we were young, even a normal telephone was a very rare thing. I remember when I applied for the first telephone connection, that was in the early 80s. The waiting period was 16 years. And now we carry the mobile in our phones. Previously, if someone said that's a thing like mobile is possible, it would be said that crazy hai, pagal hai. Again, we have been blinded since ages that kidney stone which can only be removed with surgery, whereas in the 1980s, it was shown that lithotripsy can remove stones. When we installed our first lithotripsy in 1991, the surgeon would make a bet with the patient that it is not possible. And of course, my patients always won the bet. It was always thought that regeneration or degeneration of tissues, especially of the cartilage, is not possible. But in the early 90s, in the early 2000s, around 2004, when the first clinical trials were out, Dr. Raja Vijay Kumar proved that with cytotron, it is possible to regenerate the cartilage and similarly to degenerate the tumors. For so many years, we have been blinded that heart disease requires surgery or stent. But artery clearance therapy, ECP, and ESMR has broken that myth. Now, what is true in heart is true in rest of the body. Enhancing blood flow to the tissues increases tissue oxygenation. It gives us nutrients, hormones, and waste removal. And wherever this takes place, there's going to be improvement in the tissue functioning. And this takes place in almost the whole body, as you can see. The brain, the heart, the abdomen, the reproductive system, the pancreas, kidney, liver, lungs. And since the flow to all of them is increasing, the patient feels improvement in all these areas. And when all these areas improve, you can imagine. So I'll also say that ECP need not be just as a standalone treatment. I normally say that it should be the first line of treatment in cardiac diseases, unless there's some contraindication or there's an emergency. And for all other treatments, wherever you want increased flow, ECP can be an add-on therapy. Peripheral artery disease. We have seen patients who had one stent put in, then the second stent put in for peripheral artery disease. Then when we did the ECP, the patient, his pain went away, and he was from Himachal Pradesh. After that, he could walk in the hills without any pain. He was an educated engineer. When blood flow to the brain improves, then memory, reflexes, sensory perceptions, alertness, depression, planning capacity, dementia, Alzheimer's, they all start improving. And I like to especially talk about Parkinson's disease, because this is where we have started treating now. We are not treating too many patients, but patients who we are treating, they have improved. Some say 40%, some say more. Let us see, because if we are too young in the treatment of Parkinson's disease with ECP, maybe it will be possible. Because the reports say that treatment with ECP, 92% patients improved, whereas those with medicine, 81 improved. Another report was ECP improvement 73%, medicine 43%. So maybe over time, with more studies, we may be able to improve on the results, and maybe ECP may become the first line of treatment for Parkinson's. Then cerebral ischemia, patients who have had a stroke. I don't advise it for hemorrhagic, for ischemic strokes. It is a very good treatment. Alzheimer's. Again, when the flow increases to the brain, the patient should improve. We have been so far using it only for heart, but now, and for peripheral artery disease. Now we are shifting over to the other indications. Vision. Yes, we have seen effect of ECP on the vision. Patients' improvement in the vision is well known, and we have seen this effect. Erectile function. This is again a very, very important subject, and there's very good improvement in patients, to the extent that someone said that, Dr. Sibia, don't do ECP for persons who are not married or who are widowers. Sudden deafness. I'll say not only sudden deafness, even decreased hearing. Even for those patients, ECP is a very good modality. I'll come to it a bit later. Tinnitus. It is reported that patients who had tinnitus, they benefited because of the vasodilatation effect. This is another very important field, post-COVID. I think a lot of us are suffering from post-COVID. And for all these patients, ECP as a post-COVID rehabilitation, not only for the heart, but for the lungs and for the rest of the body, can play a very big role. Because long COVID affects our multi-organ, heart, lung, kidney, skin, brain. And ECP is able to improve the energy level, tiredness, fatigue, muscle weakness, balance, dizziness, chest pain, palpitation, and a lot of other things. So for post-COVID patients, I'll definitely say that ECP must be tried. And ECP as an anti-aging therapy. Where there's blood flow, there is life. We are as young as our arteries. If we improve our blood flow, we will improve the whole system. The picture you are seeing in the center is of a patient. He was a saint, around 80 years. And it was very interesting. When he came to us, his beard was all gray. And after treatment, we could see streaks of black. His hearing improved, so much so that those people who were young, his followers, who always thought he cannot hear too much, would be joking among themselves. Of course, some jokes in the younger age are not always relished by the elderly. And after treatment, they told me that Dr. Sibia, you have created a problem for us. Previously, Babaji could not hear us when we made jokes among ourselves, and now he's able to hear us. His vision improved. After his treatment, a couple of months after that, he had a function in his dera. We went to him, and it was an evening function. In that low light, he recognized us from a very long distance. So this is the role of ECP. Once we are able to establish the flow and increase the flow to all parts of the body, it is truly a holistic treatment. So don't think ECP to be only for the heart. Think it as a holistic measure. Someone even told me that someone in USA, he is treating knee arthritis with ECP. Of course, he said they are taking 90 or 100 or more sessions. And the reasoning was that when blood flow increases, there is regeneration of the cartilage. I don't know exactly how it happens, but this is what was reported. And they are also treating for cancer. Again, when we increase the blood flow, increase the oxygenation, the cancer cells will find it difficult to survive. Again, there is no authentication of this, but this is what I've been told, and I'm open to trying it for all this, and we all should be open to try all therapies which can benefit the patient. It is important to know that while modalities that increase oxygenation have been shown to benefit several conditions, their use is not universally accepted for all medical conditions, and more research is needed to fully understand its mechanism and effectiveness across various health issues. They should be administered under the supervision of a qualified healthcare professional. We are here because we are different. All the people, all the doctors who have joined or who are practicing holistic medicine and who are practicing functional medicine, it is because they are thinking different from what most others are thinking. So we are here because we are different. We are here because we want to impact lives. We are increasing in our community the number of doctors practicing functional medicine now going up because they have seen that functional medicine can impact lives with minimum or no side effects. So I'll just say, carry on, dare to explore new treatments, and there's no limit to what we can achieve. Thank you. Thank you very much. Thank you, Indian Association of Functional Medicine. Thank you, Dr. Preeti. Thank you for all the organization. Thank you. Thank you.
Thank you so much, sir, for academically enlightening the patients over here and the people who have not been suffering from, but if their loved ones are suffering from the condition, they'll definitely contact your clinic as well. There is one question though, which is interesting people. What is your take on statins?
Statins, It's a very difficult question to answer. Number one, there's no universally accepted idea. Number two, statins have a lot of side effects, which are not recognized by the physician. When a patient says he is feeling weakness, when a patient says he is having myalgia, this is normally ignored. Whereas we must be open to it, that these can be the side effects of statins. I myself do not give too much of statins. I try and avoid it unless the cholesterol and triglycerides are very high. I avoid it in the elderly. And at the first sign of side effect, myalgia, weakness, weight loss, etc., I try and stop it. Here I'll try to just share experience of one patient. This patient had come to us from Bombay. This was around 5-6 years back. I think we have got 2 minutes, so I'll finish on that.
Yes, please, sir, go ahead.
So he came to us. He rang me up. He said, Dr. Sibia, I want to meet you. I said, come over. He came to me, a lean, thin person. And he came to me just to tell me, Dr. Sibia, you are doing a wonderful job. I said, can I help you? He said, no, I've already had bypass. I've had multiple complications of bypass. I've spent about 35 lakh rupees in bypass and the complications. This I'm talking around end of 1990s.
Yes.
He said after that, and my wife asked him, you are so thin, how is it possible? His answer was, Didi, मैं पहले बहुत मोटा था. जब मौत सामने आती है, तो सब कुछ छूट जाता है. पहले मैंने कोई ऐसा नशा नहीं है जो ना किया हो. He was a don. He said कि हम कितने लोगों को मारा है मुझे नहीं पता, लेकिन जब मौत सामने आई तो मैंने सब कुछ छोड़ दिया. And what was coming to is, he said, I almost became blind due to the statins.
Yes.
His retrobulbar fat decreased so much that everything went out of focus and he could hardly see. And he said, after that, wherever I see someone is doing a good job, trying to save people or giving alternative to surgery, I go there just to thank them and tell them, please carry on, you are doing a good job. I think this is how I can sum up about statins.
Yes, thank you so much, sir. It was much needed for the audience as well. We as practitioners know, but as audience, you have clearly summed it up very well that how it is a myth that statins work in cardiac disorders, but it doesn't. Yes, thank you so much, sir.
Here, I'll just add one more thing.
Yeah.
Why talk about statins? Why not about the aspirin?
Yes, blood thinners as well, right?
How many times do we do a test for blood thinners before we prescribe them? We are doing cardiovascular cartography where we are studying the thrombus formation factor in every patient. So only those patients who have got a high thrombus formation factor, which are less than 50%, maybe around 30-40% or 20%, only those are the patients who really require aspirin, not others.
Thank you so much, sir. I guess everybody has taken the knowledge from the pioneer in cardiovascular conditions. Thank you so much, sir, for joining us and being a speaker at the IAFMCON 2023. Thank you.
Thank you, Dr. Krishma. Thank you very much.
Thank you so much, sir. Thank you.